Once the procedure has commenced, the doctor will use certain instruments to perform the procedure that he needs to do. For instance, the septum is often straightened out using an elevator, such as the one you see here. This is used to raise up the membranes on the sides of the septum and take out the crooked cartilage or bone as needed. When the doctor wants to work on the tip, he'll make incisions inside the nose and he'll pull the tip cartilage outward so that he can operate on them. In some instances, the doctor wants to do what's called an open rhinoplasty, in which case they're making an incision at the base of the nose and pull the skin over the bridge. Here, I have my personal bias, and since I've been trained to work well inside the nose, I don't feel the need to make that incision except in very rare cases. I do what's routinely called a closed rhinoplasty, and I believe that that is better for the patient in terms of reducing tip swelling and complications. In any case, the tip cartilage is exposed so that the surgeon can work on it, and bits of cartilage are removed or recut or sewn together to achieve the desired shape. For instance, if someone has a bowing or bulging of this tip cartilage, when they expose it, they'll actually see a curved shell. And the doctor will remove small segments of that, or even crush them with a clamp, or do several different procedures to try and make it flat and smooth. Cartilage is this sort of rubbery part of the nose, the mobile part. Maybe you remember from seeing the skull that the nasal bone ends way up high up here. So if the doctor wants to fix the cartilage of the nose, that's all this mobile part. After we're dead, this mobile cartilage eventually dissolves or disintegrates, and the bone is still left. When a person's got a crooked nasal bones, or they're elevated too much, the doctor may feel the need to either file them down or to fracture the nose and remove a segment of the bone. The fracturing or rasping of the nose, as the filing is called, is typically done through the inside of the nose. What happens is the doctor will elevate the skin of the nose so that the bone and cartilage is freed. And then, using either a chisel and a hammer, such as these, they may fracture the bone in regular places to produce the desired shape and allow the repositioning of the nasal bones. If the doctor just wants to rasp the bridge or file it, they would use a filing instrument such as this one, with filing blades that can be used to reduce the bony surface. In some cases, we're doing both. We're doing a little bit of rasping and filing, and then we still need to fracture the bones to the midline using the hammer and chisel. I compare this to almost a jeweler cracking a diamond, and the bone cuts need to be made in just the correct place and the right amount of bone removed to achieve the desired result. Even when the doctor performs, of course, a perfect procedure, that doesn't mean you'll always get a perfect result, but what it means is that you're on the right road. The healing process has a great deal of variation, and everyone's nose is different. Everyone's procedure is also, while it's somewhat the same, it is somewhat different. So while we may be doing a lot of the same steps to reduce a bridge or to add on to a bridge, everyone's nose has its own nuances. After the procedure is performed, some doctors will put packing in the nose to minimize the bleeding. I personally, again, do not feel that it's necessary. I give patients instructions so that they don't need to do that. Also, the doctor may put a splint on the top of the nose. That's used to maintain the shape, to minimize swelling and bruising, and in some cases to minimize bleeding as well. If you follow the instructions and you are a well-educated patient, you will find that your recovery from nose surgery goes very effectively and you can get a great result.